Well, good morning. Good morning, and thank you so much to Dara and the entire Feminem crew for inviting me to be here today. It is such an honor to be here with all of you. I was saying how I've spoken to groups of politicians and policy wonks, but being here with my fellow women physicians, this is seriously intimidating, but also incredibly humbling, so thank you. So the topic is empathy, equity, and empowerment. Thank you. How female physicians will heal this nation. So it's a bit of an ambitious hypothesis to prove, right? Maybe possibly a big lift, a lofty goal, maybe even a bit arrogant. But when you consider the unique scope of perspective that we have on the human condition, and then you consider how public policy is actually created, the narrow focus through which issues are addressed and legislation comes forth, then you can see that our ability to make public policy more comprehensive, effective, and robust is crystal clear. Consider also the moment in which we are seeing that human condition. It's when people are at their most humblest, most helpless, most hopeless moments sometimes. It is when all pretenses are stripped away. It's when their failings or their weaknesses are apparent. But what we don't always realize is that it's also when the failings and weaknesses of our country's public policy sphere are apparent as well. Let's think about some of the skills that we have as physicians. We are good listeners, right? We're able to pick out rapid, important details. We can multitask, we can delegate. We can work on a team. We are proactive. We anticipate complications and side effects and negative reactions coming down the road. We are collaborative. We can multitask and delegate and all those wonderful things. On top of it, think what we have as innate skills as women. Not to be too generalized, but we tend to be fairly compassionate and nurturing. Again, very collaborative. We tend to be good listeners, very proactive. When you take the skills that we have as physicians and you consider those skills as honed as they are, and you add them to the traits we have inherently as women, then it is clear that we can be advocates for a large swath of our population on a whole host of issues. Furthermore, when women have a seat at the table, make no mistake that we not only can advocate for these issues, but we can actually look at the public policy and identify the weaknesses and where they should be strengthened, and also identify where inefficient policies can be more effective. And there are a lot of ways to have that seat at the table, but the one that I want to specifically advocate for today is for more female physicians to run for office. Because that is how, my friends, we will heal this nation. And we will do it using a simple three-step approach. We will employ empathy, we will develop a plan for equity, and we will deliver empowerment. So empathy, the definition, it's the psychological understanding or the vicarious experiencing of another's attitudes, feelings, or thoughts, right? Synonyms include rapport, insight, compassion. Well, this is what we do in every patient encounter, right? This is that interaction we have with patients. We take that time to understand the constellation of other factors that are contributing to their current history of present illness, right? And as we do that, it allows us a very unique view. And even though we try to maintain our emotional disconnect, right, as professionals, it is our job, it's our obligation to make sure we employ that empathy when we see patients, even when sometimes we don't necessarily like the patient. We may not think they're necessarily deserving of an iota of compassion, but we do it because we took an oath to do just that. It is empathy that allows us to see, for example, the homeless schizophrenic, the meth-ravaged college sports star, the chronically exacerbated asthmatic, the drug-seeking migraine patient, the 9-month-old with a femur fracture, the 15-year-old in cardiac arrest, status post asphyxiation, the 8-year-old who's been accidentally shot by their cousin. It's empathy that allows us to see all of these cases as evidence of public policy failures. Now, I'm not suggesting we take out all volition and human will and our personal human agency out of the equation. Obviously, yes, we have choices, and we are the products of the choices we make. Agreed. But let's acknowledge this, that sometimes those choices are made for us, and sometimes there's a limitation to the choices that lie in front of us. And when we identify that those choices are limited or absent, it is usually because of a result of public policy failures. Equity. The definition of equity is the quality of being fair, of being equal, right? Synonyms include rectitude and even-handedness, right? So making fair, making even, making equal. So when we consider equity, think about it, that's what we assess when we see any patient, right? We know the difference between discharging, for example, a 7-year-old little girl who sustained a laceration on her chin in her bathroom versus the kid who sustained the laceration at her dilapidated playground equipment in her Title I school, right? There's a difference when we discharge a 18-year-old status post of spontaneous AB and the community resources that we have to make sure we offer her than the married mother of 3, right? Think about the 78-year-old elderly widower who has come in status post a pre-syncopal episode and has bruises of various ages. There's a difference in how we discharge that person than the one who, and that one who lives alone than the one who lives maybe with family. Think about the difference if we have a patient with bipolar disease who lives in a halfway house and is non-compliant with their medications. That person is treated and discharged very differently than the one who has a full-time caregiver. Yes, some of these differences are obvious, and yes, these are EM examples, but let's be honest that they exist in all areas of medicine, do they not? And they may seem very obvious to us, but it is amazing how frequently these obvious differences have been either overlooked or exacerbated by poor public policy. Consider these exacerbating factors. A mom who can't take time off of work to take her child in for a wound check. An uninsured diabetic patient who can't afford their insulin. The elderly couple that is now going into assisted living that cannot take care of their grown autistic son. Or the 35-year-old high school dropout machinist who's dealing with perpetual joblessness, who's driven to narcotics to cope. These are all either direct effects or collateral damage of ineffective or weak or absent policies. And what we do as EM physicians or physicians in general is we look at those inequities, right? We assess that and we decide that the needs require certain interventions. And so what do? We develop a plan for equitable treatment, and we work very hard to ensure equitable outcomes. Furthermore, as women, we see things in a holistic way, right? We don't see anything in a vacuum. So we don't see one issue being unrelated. We know that those issues are related, whether it's related to education or the healthcare system or economic opportunity. We know that those are multifaceted, and that leads into other things like addiction, domestic violence, gun violence, environmental issues, poverty, and so forth. All those things are interrelated, and we know that. So when we can actually assess that, that is the crux of public service, right? When we can assess those inequities and we can address them, that is what public service is all about. Empowerment. Definition of empowerment is to give authority or power to. And synonyms include permission or promise. This isn't just about empowering our patients. This isn't just about empowering their caregivers. It's about us being empowered to go forth and create real change, because we have a unique perspective on that human condition and how public policy impacts people on a daily basis. And we've seen people's lives be eased by good public policy, and we've also seen the tragic opposite. So whether it's joining an advocacy group, working with a nonprofit, participating in legislative activities, lending your expertise to journalistic endeavors, maybe supporting candidates or elected officials that align with your goals, whatever it is, we need your voices. Speak out about gun violence, speak out about environmental injustice, the broken healthcare system, our struggles with the mental health care system, the civil right that is women's reproductive health. Yes, absolutely. Speak out about all of that, and then some. We need your voices, but then, when the time is right for you and your families, I want you to consider doing something else. Demand a seat at the table and run for office yourselves. We need you. We have an incredible ability to empower ourselves to speak up for a swath of this population that otherwise does not have a voice. And it is incumbent upon us to recognize that power. Information is power, right? But we only have that power if we acknowledge its significance and we utilize it for greater good. And we relinquish that power if we neglect our role in public policy development. To relinquish that power and to willingly stay out of this arena, it's not just a shortcoming, but it is an act of privilege. And quite honestly, my friends, that is an act of privilege that our country cannot afford. So I would like to end with a brief chant, a battle cry, if you will. I want us to repeat these 3 words 3 times over, a little louder each time, okay? All together with me. Run, Doc, run. Run, Doc, run. Run, Doc, run. Thank you.